Good evening, I guess. My name is Anushika. This is Mike, and we're representing Team Tepper Up. And today we're going to talk to you about our solution Rehab, which is a gamified AI-driven rehabilitation product that's specifically focused towards helping low-income minoritized communities with their physical therapy needs post-surgery.
We'll first talk about an opportunity gap which rehab can enter and Optum can help support, and then introduce you to Anita, a person who recently broke her wrist and could benefit from the solution that rehab has to offer. We'll next take you through a patient journey and provider journey through our mobile application and similar provider-facing dashboard. And before we open it up to questions, we'll take a quick look at the market sizing and valuations.
So racial disparities are pretty heavily embedded in the U.S. healthcare system, but in the last decade or so, there have been initiatives that have been targeted towards collecting more racial and ethnic data in medical practices so we can identify discrepancies that can help us bridge the gap in fundamental care. But when we were exploring the space, we were surprised to find that a lot of these initiatives have strong success in creating parity in the initial treatment, but there is little change in the outcome differences. So there is a black box in the middle, which is the area that we're focusing on, that we wanted to investigate through this case. Now primarily low-income minoritized populations are less likely to receive rehabilitation referrals after discharge, and they're less likely to be seen for injury-related outpatient visits. And so this can stem from provider bias. It can stem from a rehabilitation program that doesn't work for them. And there might be a belief on the provider side that because these patients are underinsured or lack insurance, they might not be able to afford physical therapy. Racial discrepancies contribute to worse long-term trauma outcomes, and research has found that low-income minoritized populations are less likely to have a long-term care strategy for pain management. So they rely heavily on ED services for their routine care needs. This is a very heavy burden on the medical healthcare system right now. So we're focused on high quality care, which is high patient provider engagement with improved outcomes. We're focused on low-income minoritized populations, so we're looking at Black and Hispanic individuals and families that are underinsured or may not have the income to support out-of-pocket expenses for physical therapy. And we're focused on a positive and comfortable patient experience. So we're looking at high patient satisfaction with no perception of bias. For this, we specifically focused on a very common traumatic injury that requires physical therapy, which is wrist fractures. Wrist fractures are very common, they're very treatable, but they also have a connection towards long-term pain and long-term disability. So there's about 720,000 wrist fractures that happen in the US each year. Of them, about 575,000 go without any rehab. This is a huge missed opportunity for us. And by filling this gap with our solution, we're hoping that we can target about $250 million annually in benefit to patients and to Optum in terms of savings. So meet Anita. Anita is a Black woman, a middle-aged Black woman who works 2 part-time jobs to support her family. Both of her jobs do not provide her any kind of insurance. During one of her shifts at work recently, she broke her wrist. She's had pins put in it. And she's currently looking for a physical therapy program that will fit her requirements. So she wants to connect with a therapist who she can trust and who she can forge a relationship with as she tries to get back to her normal life.
So Anita is first introduced to rehab through a CIEL, Clinical Informatics Education Lead, which is typically present at the facility she would have received surgery. There, the CIEL will take her through the registration process, as well as describe the purpose of a rehabilitation plan. Every day, rehab then prompts Anita to answer a single, simple, outcome-oriented question to track her pain over time. In addition to these questions, Anita will also complete gamified exercises, pulled from a wide library of exercises activating her wrist, as well as coaching tutorials on how to perform these exercises. This rehabilitation plan will then take her results of performance and adjust the games that she's playing, as well as the mechanics within, in order to support a long-term care strategy. Now, whenever Anita reports an elevated pain level, Rehab would also prompt her to connect or visit a physician within her area, hopefully managing her pain strategy actively and keeping her out of the ER. Importantly, the matching process occurs around Anita's demographics, geography, and availability, hopefully building trust as well as feasibility within Anita's lifestyle. Now, all of this would be incomplete without similarly strong provider-facing tools. This rehab system, because it's actively able to track Anita's performance over time, is able to provide recommendations towards the physician on needed next steps in her recovery, whether that be, again, additional pain management tools, more active rehabilitation exercises at home or with a physiotherapist directly, as well as removing some of the bias which might be appearing in the rehabilitation process. Importantly, through rehab's responsive and flexible rehabilitation process, as well as higher compliance we're expecting through gamified exercises, Anita is able to return back to work safer, stronger, and sooner. Now, partnering with Optum provides a unique opportunity within Rehab's platform across Optum's entire business line. Within the first year, we're expecting about $140 million, shortly after launch, we're expecting $140 million in savings potential towards all health payers, and United Healthcare included in that. And as we expect to scale by about mid-2025, expanding to new opportunities such as wound care, total joint replacement, and stroke, provides integration of data across the full patient recovery journey to be brought into some of the insights which Optum Insights recommends to facilities supporting cost mitigation strategies, as well as outcome results. Oops. We expect Rehab to be able to provide the equivalent of 2 physiotherapy sessions per patient. What this results in is about $140 million value extension being offered to patients. Now, this is not something which is directly realized to Optum, as about 3/4 of which is directed to patients who currently don't receive any physiotherapy. However, we've already noticed that that population is specifically benefiting as well minoritized populations. The real cost savings come out through the reduction in the reintervention rate coming from reduced malunions for people who don't have physiotherapy right now, as well as a reduced volume of emergency department visits related to pain, about 18% of which happen, about 18% of all emergency department visits within 30 days after the surgery.
So to conclude, I want to draw us back to the important features of Rehab that make us unique. We have a quick patient check-in and a live provider dashboard, through which we aim to optimize time and flexibility and improve communication between patients and providers to ensure maximum adherence to pain management regimes. Rehab leverages AI to improve patient and provider matching and aims to eliminate bias and optimize equitable outcomes. Most importantly, we would be the only platform supporting small trauma recovery through combined rehabilitation programs and patient recovery tracking. Chronic pain resulting from traumatic injury can be very debilitating, and it can impact a person's ability to live their life fully. With the focus on post-surgery rehabilitation, Rehab hopes to help millions of underserved Americans return to their normal lives in a healthier and safer way.
So just to be clear, so this is a telehealth platform that will match physical therapists to an individual, correct? It's not prescribed? It's self-directed, or is it prescribed through? You mentioned like post surgery, or so would you be marketing and partnering with providers?
So a couple clarifications, and this is good. The service itself does not directly provide the service of the physiotherapy matching. So it is not a telehealth system. It is directing patients towards a physiotherapy system. However, what it is providing is basically a gamified exercise, something you can take home, do on your own, fit into your own time schedule, which is taking the place in between those physiotherapy visits that otherwise would not be happening. Similarly, however, what you talk about in terms of the referral, yes, that is being referred across through the provider itself, and whether that be directly at the system or, again, following a reimbursement tag, a flag then to download an app, go through the system, again, filling that gap of rehabilitation that would otherwise not be offered.
Wait, so what's the route to the PT? Is it through the provider referring, or is it through this surfacing one that they should go to based on their insurance, and then the provider refers?
So currently, the gap exists where providers are to recommend people across towards physiotherapists. The unfortunate thing is that just doesn't happen frequently enough. And specifically, that doesn't happen for minoritized populations. Again, talking about that bias that we were discussing. So importantly, what this app does is it takes that referral process and says, hey, here's a physiotherapist which would match your needs, your proximity, your location. And then you are entirely correct. The referral incentive does work across between the physicians that way. However, the app itself is taking that referral process, again, finding that appropriate match.
But the provider still has to then get the patient to use this.
That is correct.
So why would they, if they're not doing a referral to a provider because of the biases you're talking about, what would make them give you this because of those same biases?
So, and again, these are really good questions. The first bias which appears is we don't believe you're insured. We don't believe that if I suggest you towards a physiotherapist, you will show up, you'll be able to pay for it. And this is a couple noted literature items that I know there were references down below, all of which were directing towards those two primary biases, again, directly related towards insurability. Now, the intent with this app alone, again, is it is able to fill some of that gap. The fact that we anticipate it being able to support that rehabilitation process as a half step even is better than nothing. With no cost towards the patient for downloading the app and being able to play some games, get that wrist activity moving. However, when it is needed in those instances, then that referral is then able to be made.
And then you had that chart that showed, you know, how much Optum was going to save and then how much of that savings would be sort of, you know, realized with underserved populations. So it sounds like what we were just talking about here, that's that 112 million, right? Like those are the patients that right now aren't even being prescribed any physical therapy. We're going to try to, hook them on this app as a pathway in and there's savings there. Like what's going on with all this other stuff? So these are, on the direct side, these are patients being treated in the Optum, United Healthcare environment somewhere, and they're also using your app, or where do these people come into play?
So everyone who's listed here is across the entire healthcare system. And just to jump across towards some of the data that we have on the side, what we're looking at here is, again, the total number of patients and the value we'd be realizing across some of these potential volumes. Importantly, emergency department visits, as well as reintervention risks. You're completely right. This is not reduced in order to take a look at United Healthcare's penetration, right? These are cost savings, which we mentioned. These are not to necessarily be realized within, let's say, the traditional sense. However, again, we talked about some of the scaling issue being able to be brought across other treatment areas, right? That is really the revenue opportunity for Optum to jump in on this. There were indications which we talked about of heavy investment going in towards facilities, talking about this racial equality score, where this equity data and new metrics were being brought into place. Importantly, that's where this rehab app steps in when we talk about scaling. This is something Optum Insights is able to own, track a patient's journey after any intervention, and convert that over towards a metric for facility-based racial equality. Again, ultimately, rehab is a first step into this business for Optum to then convert it over towards a data system, while still realizing revenue gains or cost savings along the way.